Before we finish out the joint series, I wanted to take a moment to talk about lameness in dogs and when it's appropriate to still hunt and run these dogs with a lameness, and when you do need to put them on the shelf and give them rest in anti-inflammatories or whatever it is. Where this kind of came home was that Boomer developed a very firm swelling at the end of his wrist at the end of the season. So 1 week left in the season, and it could have went a couple of different ways based on the diagnostics. And it got me thinking, so often I hear people say that they get the advice of here's your rest and anti-inflammatories, and they put that dog on the shelf. But if we find out what they have going on, there are some cases where we'll hunt through that discomfort, or that we can continue performing at a normal level, understanding that we need to deal with that discomfort. So much comes down to the tissue that's involved. And I think that that's the biggest hurdle for most people, because oftentimes we don't get that diagnosis. And so whether it's, in the form of your veterinarian being able to identify where the pain is coming from and then doing appropriate diagnostics, or being able to interpret the signs from the dog. And so I wanted to take Boomer's case as an example of the thought process that I go through as I'm looking at these cases to decide, is this a dog that I can hunt or a dog that maybe needs to stay on the sidelines for a little bit? I will tell you, I hunt a lot of lame dogs. And so it's not that I'm careless. It's not that I feel like we need to do it no matter what. It's that I'm familiar with the tissues that I feel that we can push these dogs through and the tissues that we need to stop and give them rest or go down another path. A lot of this comes from my own experience with my own body. I used to marathon a lot, and so it's one that even now at the end of the season, I had a horrible Achilles issue that I've been seeking care from my physical therapist to get me through the season. And now that we're in the off season, I'm going to take a different path so that I can start the recovery process. But my issue wasn't such that I had to worry about an Achilles rupture. It wasn't plantar fasciitis like I thought. Once I got an accurate diagnosis, we were able to manage through it. And I think that that's the key issue with a lot of these dogs. And so we're going to take a look at Boomer's x-rays and then kind of discuss my thought process and the thought process you should go through when it comes to whether these dogs should stay out in the field or not. In Boomer's situation, what I saw was I came home on a Saturday and he had been in his crate. And when I got him out of his crate, he had a firm swelling on the end of his wrist, or his carpus is what we call it in the dogs. And it was very firm, very swollen. And so I do see this a lot in pointing dogs, but typically it's young pointing dogs. And what I think occurs with them is that when they're striding out, that sometimes they'll hit the stuff on their neck. And so whether that be a big GPS collar or a training collar, where I experienced it first with a lot of my sports medicine was in Maggie, my very first setter. And I'm old enough that I had her before the days of GPS. And so when I lived up in the grouse woods, I actually ran her with a bell. And when I came out to the prairies, I continued to run her with a bell. And I think with her, when it occurred, I think that she probably hit that bell as she was really striding out on the prairie. And so it's one that we see commonly. Here are a couple of pictures that I even got this year from veterinarians of dogs that they had questions about with this. It's typically in young dogs. And so with Boomer, he's being an 8-year-old dog that had never experienced these issues. I did get concerned for things like osteosarcoma, because this is the way that osteosarcoma will also present, which is bone cancer. And so you can have where the dog gets a firm swelling that you just notice. And so likely the cancer is brewing there until it gets to a point that it's noticeable. In Boomer's case, he was not painful. When I examined the wrist through all of its range of motions, looking at tendons and ligaments, I didn't get any discomfort. We had been battling wrist issues on the other wrist all season, but this particular wrist, he had not been problematic. And so it really set off a lot of red flags for me. And so we rushed him into the clinic right away to take x-rays. And you can see here on the x-rays, the bone all looks okay. And so the swelling is in the tendons. And so he has a tendonitis, tenosynovitis, but basically just a swelling. And that's often the case with these young pointing dogs that get a firm swelling. The thing I'd like to point or to reiterate though is get the diagnostics done. There are some bad things that can occur even in young dogs. And so while this is a common condition of young dogs, you don't want to dismiss it as that and not get these diagnostics. And so once we cleared him from knowing that it wasn't osteosarcoma, then I was able to decide, do I put him on the shelf, which would be the best option to get this to resolve, or because we had a week left in the season, could I manage him through it? And so appropriately rest him in between the days that we're hunting as opposed to doing our runs like we had. And so it's one thing I'd like to point out is these diagnostics. Too often people look at these machines as sort of magic boxes that are going to tell us exactly what's going on in the dog. And that's not always the case. And so it is something that gives us a piece of the puzzle. And so it's a diagnostic, not the diagnosis. And what I mean by that is you have to take the information that you get from this machine and relate it to the findings that you have in the dog. And so too often I'll see dogs referred in that we make a radiographic diagnosis and treatment plan, but what we're finding in the dog isn't necessarily the case. And where we'll see that is particularly like in the shoulders. It's very common in these athletic sporting dogs to have some mineralization that occurs within the tendons of the shoulder, and people will think that it is arthritis or arthritic issues when the problem maybe is further down in the elbow or the wrist where the dog's actually painful. Same way in the back end. If I have a dog that suddenly starts limping later in life and we x-ray the hips, even if the hips are bad, I would wager a lot of money that oftentimes that dog's problem isn't going to be hip dysplasia, but rather that it has something else going on, and often the case is going to be in the knee or further down in those dogs. And so it's taking that information. If I have a dog and it's a young dog that's been limping and it's painful when I examine those hips, and then I take x-rays and there is hip dysplasia, then I have a diagnosis, right? My exam findings fit with my x-ray findings. It is vitally important though that you put the two together. And so there are a lot of times that we treat x-rays and it's not the best path for these dogs. And so same with whether we can run them into the field is going to be based on not just these findings on this machine, but also the findings of the dog. And so we'll talk about how I work through that with Boomer in this next section of the video. In these situations with a dog that has a lameness or a diagnosed problems, I kind of go through a decision tree as to whether I'm going to hunt these dogs or not. And the first thing I'd like to say is that just because we diagnose arthritis doesn't mean that a dog shouldn't hunt. And so I'll go back to myself as an example. So 20 plus years ago, I had a cruciate ligament repair in my right knee. At that time, so I was in my 20s, it showed arthritis in my knee. And so I think so often we get that diagnosis of arthritis and people think, oh, I'm going to change everything I do. I have run literally dozens of marathon, half marathon, triathlons, and thousands of miles both on my feet and on the bike with no problems in that surgically repaired knee. Knock on wood, because I am also getting older. And so it's one that we all, when we use our joints, have arthritis. And so Boomer, again, as an example, there is arthritis in both of the carpi. And so he does have issues that are brewing. I think that's what's responsible for the lameness that we saw in his right. And it's something that will manage him for the rest of his career, probably, as far as not trying to allow that to worsen or become more problematic. One note on the carpus, or the wrist joint in a dog, is that I do think that some of these dogs, because of all the twisting and turning, they do get a certain degree of arthritis that happens in these joints. What we'll notice is that as they age, they lose some of that range of motion in the joint. I think that's the body's way of kind of bracing it, basically. And so I don't get too worked up unless a dog is super painful or continues to be painful in the wrist. In a situation like Boomer's, where I know it's a tendon and I'm not going to cause something like a rupture, and so if I have a dog come in that has a swollen Achilles, that's going to be a dog that we're probably going to strategically try to work them through the lameness, because sending them out in the field, we probably would rupture that Achilles tendon. And so it's going to depend on where the injury is. A vast majority of dogs, though, we can kind of run through these issues. And so the other part that's going to be dependent is what's our goal. And so I've had dogs come in with partial cruciates that, you know, it's maybe the dog's last season, or the dog has not had an opportunity to hunt. The people's schedule doesn't, you know, favor surgery. The dog isn't necessarily fully lame. It just is sore after hunting. And so I've had situations where we'll hunt a dog on a big hunt, whether that be opening day or someone had a trip, and then do surgery afterwards. And so there aren't a lot of these conditions that I feel that we make infinitely worse or that we can't undo the damage, even if surgery is on the table. With other conditions, we're not going to change the path so greatly by doing exercise that we need to make those decisions. So do we want a dog that we can actually have out in the field, or are we going to retire them? And so I think the other part is that people get into this mindset that an athlete should never be painful, and that's just not the case. There's the athletic pain, the pain that you can, I don't want to say go through. And so we're not talking about when you hear, you know, someone injecting lidocaine or novocaine into a joint so a football player can play. Not that. I'm talking about the aches and pains that come with activity. And so as I've aged, I have a lot more aches and pains when I get up in the morning than I did when I was younger. And we see these same things in our dogs. And so it's being conscious of, are these normal that the dog warms out of and feels good once it gets moving, or does activity make them worse? And so if it's something that a dog warms out of and seems to loosen up and do well, that's going to be a dog that I'm likely going to run, versus a dog that's just miserable because we did what we did. That's going to be a dog that we're going to step back and maybe take another path. And so it's going to relate on communication between you and your veterinarian. and what are my goals with this dog? And so in a case like Boomer's, yep, ideally going on rest is going to help resolve that swelling in his wrist. But I knew that we had about 5 days left of the season. And so he's going to have rest now that the season is over. And so I elected to hunt him 3 days, and he hunted hard. You can see from this screenshot from my Garmin that midweek when we were out hunting, he was able to still maintain almost 20 miles an hour and covered over 20 miles that day. And so it's something that I did not notice a drop in his performance at all. And so had he come up lame, I would have reevaluated in the moment. And so it's also not a decision that we have to make and stick to. And so the big point that I would stress here is get an accurate diagnosis. And so it's going to take diagnostics. And so depending upon what's involved, there may be x-rays involved, but then it also comes with an exam finding on the dog. And so one of my biggest frustrations is to get that dog in for a second opinion that the treatment plan is rest and anti-inflammatories when we don't know what we're resting. And so the big thing is finding a diagnosis so that we know whether rest is the option or not. And so it's no fault on other veterinarians not being able to find that diagnosis. And so some of these exam findings are very, very tricky to find. And what I would stress is that if your vet doesn't give an answer of this is the problem, other than it's just limping, or we saw something on x-ray, but we're not sure if that's causing the problem, here are your drugs and rest, I would ask for a second opinion so that we can find what the problem is. And so a lot of these shoulder dogs, we're going to manage through the season. A dog like Boomer, we're going to manage through the season. And so it's identifying that tissue to decide, can I continue to hunt or will it be detrimental to these dogs? And the reason I take this approach is that each season can be as much as 10%, if not more, of this dog's life. And so they love doing what they do, and we love doing it with them. And so if I'm able to do that in a way that's safe and practical for that dog, I'm going to get that dog out in the field. And so the important point, and the only way I'm able to do that though, is through an accurate diagnosis. And I can't harp on that enough. And so that's going to be your exam findings, the symptoms of the dog, and then any diagnostics we do like x-rays. Taking that big picture, putting it together and determine what do I need to do to get this dog the best life possible. And in many cases, it's going to be able to manage them through the condition. And then like now with Boomer, he's going to have some rest and we're going to get that swelling under control. I'm going to make sure that I don't have it become a nagging, lifelong type of injury. But we had to identify what the structures were involved, because I will tell you, this would be a completely different video and a completely different course of action had that x-ray shown osteosarcoma. But until I did my exam findings and did the diagnostics, I couldn't make that game plan. So make sure that you're getting an accurate diagnosis, not just having diagnostics performed, to determine, can I still hunt this dog? And I will say, in a lot of the cases with our athletic dogs, most of the cases I'm able to manage them through them, or we're talking about either surgery or other types of options. And so until you have that information, you can't make a plan. So make sure you're getting an accurate diagnosis, not just having diagnostics done.